Good afternoon, everyone. My name is Chanel
Just a
Chapman.
sec. Hold on,
Oh,
just
tell me when to go.
okay.
Good afternoon, everyone. My name is Chanel Chapman, and I am the EHE coordinator. The EHE community educator at Lifelines Counseling Center. Today is National Black AIDS and Awareness Day. This day was marked in 1999 as a grassroots education effort to raise awareness about AIDS, HIV, prevention, care, and treatment in communities of color. It is an opportunity to also spark conversations such as this and highlight the work being done to reduce HIV in the Black community. We thought it only fitting that today we launch our new program at Lifelines, EHE, or Ending the HIV Epidemic, along with our team. Again, my name is Chanel Chapman. I am the community educator. Our EHE coordinator is Kelsey Bryant, and Ashley Rocker, our peer navigator, will now introduce herself and tell you a little about what she does.
Good afternoon, everyone. I am Ashley Rocker, the EHE peer navigator here at Lifelines Counseling. I act as a linkage of care between the services that we provide here at Lifelines to the patients or the clients that we serve.
Although it's been over 40 years since HIV started, it's still an epidemic that not only plagues the United States, but the state of Alabama and Mobile. So much so that the U.S. Department of Health and Human Services began this initiative in an effort to end the HIV epidemic by 2030, by decreasing the percentage of new cases by 75% by 2025 and 90% within 90% by 2030, therefore ending the epidemic. HIV, like so many other issues for Blacks, is a civil rights issue. Blacks account for 44% of the population living with HIV in the United States and make up 12% of the total population. Black women are disproportionately impacted than any other race, only second to Black men who have sex with men. This equates to 60% of new infections in the United States, despite us making up 15% of the entire female population. In an effort to bring awareness to the Black community, we are launching this live called We See You, a monthly event that supports, educates, and advocates for our community and further the mission of Lifelines Counseling Center. Lifelines is a multi-service organization that offers other services such as mental and financial counseling. We house 211, and we also house the Rape Crisis Center. HIV, like so many other things, is overlooked in our community, and this is our effort to bring awareness and education to our community. Kelsey and Ashley, do you all have anything that you'd like to add at this time?
I would like to say that I am very, very excited about this new work in the community for us. Of course, Lifelines as a whole is not new to the community, but this type of work is, and I'm just very excited about the individuals that we will get a chance to engage with, and learn as we go as well, because we are definitely not experts. We are always looking to learn more, to gain more insight, and just gain more partnerships within the community. So we are very excited about this. And I don't know if Chanel has already stated it, but not only are we in a pandemic, I mean, this is HIV is still an issue. This is an epidemic. So not only are we in a pandemic, we're dealing with an epidemic still as well, especially in the state of Alabama. And it is very serious. Even though it's been put on the back burner, it's still here. And it is still very real. And we still have a lot of people that are dealing with it. So we are excited about all that we will learn, and all that we will be able to share. And so when we put it out in the community for you guys to join these focus groups, make sure that you join them. We want you here. We want to engage with you. We want to converse with you. And there will be incentives. So for your time and for the knowledge that you are going to share, we don't take that lightly. We don't take it for granted. So definitely will be incentives for you joining the conversation, but we want you to join the conversation. All of these things should no longer be taboo. It should not be a problem to talk about HIV. It should no longer be an issue to talk about sexual health and things that concern women, and especially Black women. So these things are very important and they need to be talked about, and we are ready to start those conversations and to keep them going. So I am looking forward to that.
So please follow us on social media so that you can be in contact with us and know when our face group, but when our focus groups will be coming up, and other events that we will be having, especially around this topic.
Absolutely. And be looking out for our future Facebook Lives. I believe that we have settled on the third Thursday of each month. We'll have a different speaker. We'll have a different topic to focus on that day. And we want you joined in the conversation. We don't want to just talk to ourselves, because we see each other all the time and we talk to each other all the time about different topics. We want you guys to be engaged with us so that we can continue to learn together and support one another. Sound good?
Sounds fabulous.
All right, ladies, anything else?
Kelsey, I think you need to introduce yourself.
Need to introduce myself, yes, because I was a little tardy because of another event. So my name is Kelsey Bryant, and I serve as the EHE coordinator with these beautiful Black women. And so our job is very interesting every day, and we absolutely love what we do.
Yes, we do.
Yeah. Thank you, Ashley.
You're welcome.
And if anyone is joining us in the audience today, if you have any questions or anything, please let us know. If you do not want to ask today, please feel free to look at our website, and that's lifelinesmobile.org. We would love to hear from you. We would love to come out and speak to any of the groups that you may be involved in. And that definitely includes the faith-based community. So we love coming out. We love engaging with the community. We know sometimes that looks a little different with COVID, but we are definitely flexible, and we are looking forward to hearing from you.
All right. If there is nothing else that you ladies would like to add, I'd like to thank you all for joining us, and I hope to see you all soon.
Absolutely. And make sure you go get tested. Get tested, get tested. Know your status.
Definitely.
All right. Thank you.
Thanks.
Till next time.
Bye.